Hi there, I'm Rosemary Barton. Here's what's at issue this week. The Prime Minister says he hopes there will be good news on the healthcare front soon, saying Ottawa and the provinces are all very much on the same page.
There is a need for more money. There is a need for more delivery of results for families.
Meanwhile, provinces are coming up with their own solutions. Ontario announced it will expand the number of surgeries in for-profit clinics.
The status quo is no longer acceptable. We need to be bold. We need to be innovative. We need to be creative.
So is more money from Ottawa the solution, part of the solution? Should provinces be willing to use private facilities to help alleviate the strain? Let's bring in our panelists, Chantal Hébert, Andrew Coyne, Althea Raj, and joining us this week, Émilie Nicolas from Le Devoir. Good to see everybody. Appreciate you being here. I think there's two things going on this week. There's the Ontario announcement around use of for-profit clinics, and then there's the idea that a healthcare deal seems to be possible now. So, Andrew, I'll throw it to you first and see where you want to start, maybe on the Ontario aspect and whether that seems like a reasonable solution or not.
I think it's a reasonable solution. It's a limited and imperfect solution, but I think it's part of a broader agenda of reform that has to happen, and it's encouraging to see people at least broaching this subject. You know, there are legitimate concerns and illegitimate concerns. If it's just a knee-jerk reaction to, a private clinic for profit, I think people need to get over themselves. Doctors are private for-profit businesses already. They don't seem to have destroyed the system from their involvement. There are concerns, I think, that are more legitimate to do with, will these clinics be able to attach or to offer other services that do charge a fee, and if they do, does that become a kind of disguised user fee? If they make them conditional, on access that they have to order these services, that's a legitimate concern to look after. I think it's, at least plausible to ask about the diversion of staff question, although if they're providing service for free to the public, I'm not sure I'm that exercised about that. It's just moving from one section of the healthcare system to another. So there are these questions that are worth asking. None of them sound to me like the kinds of risks that can't be mitigated, can't be guarded against, and certainly, the last question I want to ask is this just simply adding resources to the system? In other words, how are these going to be allocated? On what basis do these private clinics get this business? Or is there some provision going to be built in where they're competing with the public hospitals? Right. What we really need is not so much more money going to the system, although maybe that's useful at this time, but getting more bang for the buck from the dollars we are spending, and competition has to be part of that.
And certainly provinces are all looking at all kinds of different solutions. We saw some announcements from Nova Scotia this week to deal with its ER. But I mean, is the money factor the big missing piece there, Chantal, or do all these things sort of have to be on the table at the same time?
Well, money alone isn't going to resolve the so-called healthcare crisis. We've been throwing money at the system for more than a decade, and here we are talking about worse shortages and worse wait times than we did when more money was put in the system. So clearly, and without thinking that Doug Ford has landed the magic recipe, clearly a lot more changes are going to be happening, and provinces will be experimenting with a variety of options. And I think on that front, the time is ripe. As for private, pharmacists are doing more and more of the handing out prescriptions for a variety of issues where you would have to go through a doctor in the past. Pharmacists, last time I checked, do not work as public service employees. They run for-profit pharmacies. So somewhere, somehow, this will be experimented. I'm guessing the proof will be in the pudding. Will it make the situation better, the system more efficient? Will people get care in a timely fashion? Those questions cannot be answered without some attempt at doing things differently than the things that haven't worked over the past 2 decades.
Althea.
So I think my colleagues have done a good job of laying out the problem. I will say I think there are legitimate concerns to be voiced in the sense that you don't create nurses and doctors out of thin air, especially nurses. And there are legitimate concerns about if you start operating for-profit surgeries that might pay nurses more? Are they more likely to leave the public system? And then are you leaving the public system that is in a lurch even more in a lurch? And what does that mean for more complicated surgeries, for emergency room wait times, et cetera, et cetera? But to bring it back to the politics of it, the one thing that I thought was really striking this week was how the Prime Minister was incredibly muted in his criticism of the deal. This is a leader that has fancied himself to be pretty much on the center left of the political spectrum. And here is an issue that speaks to a lot of progressive Canadians about, their core identity as a Canadian wrapped around public health care. And the Prime Minister uses the words like innovation. He described that as Doug Ford is innovating in an interview with my colleague Susan Delacourt. He could have just said nothing. He could have said, oh, well, I think there are concerns to be raised about this, or I'm waiting to see something along these lines. He said nothing. And as far as I'm told, it has nothing to do with the negotiations with the premiers. This is the Prime Minister himself choosing not to wade into that. And this is a giant opportunity for Jagmeet Singh, who has been dying to try to find a way to distinguish himself from the Liberal leader. Finally, Mr. Singh has an issue that clearly shows a divide between the NDP and the Liberal Party.
Emily?
It's interesting we're talking about, is this the right solution for the problem? And we all have our perspective of what the problem is, but we haven't had a conversation, a space to actually take a step back from the pandemic and be looking at what the problem actually is in our healthcare system. The Conservative opposition in Ottawa have called in the past for an inquiry into the pandemic and what happened then. There's been that as well in Ontario. But what happens now is that we haven't had a step back from the crisis mode of managing the pandemic, and as a result of that, we see the system, the healthcare system crumbling in Ontario and other parts of the country as well. We're having this conversation through the negotiation of the health transfers. We're having this conversation through some premiers, including the Ontario Premier, but also other premiers announcing more space for the private sector. But there hasn't been a formal space, for example, for experts to weigh in and see this is where we should be taking our public health care systems across Canada. We haven't had a space, except for journalists, reaching out to doctors and doctors then giving interviews in terms of what's the problem on the ground. There hasn't been also a lot of space for people beyond doctors who are in the healthcare system to formally be able to say, this is our experience, this is what we think the problem is. And then we're already into solution modes, and we think that the solution mode is private. So I think there needs to be a step taken back. I'm not saying it's likely going to happen soon, but I'm saying that's the piece that seems to be missing from this conversation.
Chantal, then Andrew,
Except that I could point my finger, if I kept all those reports, to an entire bookshelf of reports that identify the issues that are today the problem. These are not new problems. Way back when Paul Martin negotiated a 10-year accord in 2004, not enough home care, which is crowding the public system that should be used for other purposes. There's a long list, and you can find a solution that suits you going through this, because it covers the full range of what people could do, including more private input. So I would caution, having lived through that era, that again appointing some commission somewhere in some provinces and federally takes 2 or 3 years, which by then will add more books to that shelf that I keep at home.
But the other thing that the Prime Minister said in that interview with Susan Delacourt, Althea, and I'll get you to weigh in on this, Andrew, is that he's happy to see 13 provinces and territories try different things to, quote unquote, innovate. Like he wants them to try and experiment to fix things, as though this is going to play out in real time, these solutions.
Did you want me to respond, or Althea?
Yeah, no, you answer.
Yeah, well, it's a marked difference from the tone the Prime Minister took as recently as the last election, when, if you'll recall, he did campaign quite shamelessly against any suggestion of private involvement in the system. So it's welcome to see that changing. I think that's partly a reflection that this is where the center of gravity of public opinion, I think, is now. People are perhaps ahead of the political class to that extent. Nobody wants to see, or not many people anyway, want to see user fees But private involvement in a publicly funded system strikes me as being perfectly reasonable. And I agree with Chantal, there has to be room for not just experimentation, but for failure, for making mistakes. If we wait until everybody's got the perfect solution all lined up, then we'll be waiting until kingdom come. We have to get on with it, start trying some reforms. Don't try to do it all wholesale all at once, but do it piecemeal and see what works. Just get the process started.
Yeah. 30 seconds to you, Althea.
It's true that we have a system that allows the provinces to experiment and for best practices to be shared amongst the provinces. Doesn't always happen, and frankly, I think it's rather rare when it happens, but we have childcare because Quebec experimented. But on the one hand, the Prime Minister has a fine line to walk because Quebec has private clinics, British Columbia has private clinics. He can't come out full-on assaults, but he can raise concerns about the values that he has spent the last election campaigns espousing. And I guess that was my original point. It is really noteworthy that he chose not to go there.
Very quickly, Chantal, I can see you want one last.
Possibly because what the Canada Health Act allows the federal government to do is to take money from provinces. I hear Jagmeet Singh saying you should refuse to give more funding to Ontario if they're going to use for-profit clinics. I think that's politically untenable.
Conservative leader Pierre Poilievre is touring Quebec. The Conservative leader is doing what others before him have tried to do, win over a battleground province that could determine the next election.
Quelle est votre optique pour séduire les Québécois?
Mais je respecte l'autonomie du Québec.
His message, he respects Quebec's autonomy, but also thinks Quebecers care about the same things as everyone else, inflation and government spending. So what's to be made of Poilievre's tour of Quebec, and will he be able to win over support in an area that has sometimes proven difficult for Conservatives? Let's bring everyone back. Chantal, Althea, Andrew, and Émilie Nicolas. Chantal, I'm going to start with you, and then Émilie, you can jump in. Chantal, is this a lost endeavor from the get-go? Is there hope here for the Conservatives and Mr. Poilievre?
Well, he didn't take off in a positive manner in Quebec after the leadership campaign, and the numbers speak to that. This is the province where the most people have a poor impression of Pierre Poilievre, and it shows in the voting intentions. In some polls, the Conservatives are down to 17%. In other polls, they're around their usual score. To put it bluntly, non-Quebec leaders have tended to do poorly in Quebec. No non-Quebec leader has ever won Quebec, except for Jack Layton. And Jack Layton did something that Pierre Poilievre would need to do, i.e. he found Thomas Mulcair. and that gave his party more credibility. Suddenly people gave him a second look because he'd found someone who people considered a solid politician from Quebec to give his party an identity. But if Pierre Poilievre is counting on just himself and his rhetoric, I think against Yves-François Blanchet and Justin Trudeau, because remember, Justin Trudeau is a Quebec leader who is facing off against the Conservative leader who, on his way to his position, walked all over Jean Charest, a former Quebec premier, and lost his most likable Quebec lieutenant, Alain Reyes. So in this province, that's who Pierre Poilievre is, the guy who doesn't like Quebec political talent.
Émilie?
Pierre Poilievre is not very well known here yet. There's a lot of people, of course, in the rest of the country who's been following his career at the House of Commons for years, but the coverage of the House of Commons in Quebec in general tends to be not take as much space. And so the first impression we had, one of the first times that he made really the headlines here, as Chantal was just mentioning, was for those robocalls essentially he made to some of the constituents in the riding of Alain Reyes. And so that story was basically how he entered everyone's imagination. That's going to be hard to backtrack essentially after that. However, Yves-François Blanchet, who is the one person he would mostly be running against in a lot of ridings it would be mostly between the Bloc and the Conservatives, with the Liberals being a third player there. But Blanchette has been very absent from the public eye in the last year, and so obviously during a campaign it would be a different story. But it's not like Blanchette has had an amazing year as well. Right. So that also factors in the potential that Pierre Poilievre has for growth.
Althea.
Well, Pierre Poilievre is in Quebec as a charm offensive, as both Chantal and has mentioned, in terms of, I think it was Chantal's column pointed out that in Angus Reid's survey, he's at 44% of Quebecers who have a very negative view of him. So his charm offensive, he's doing, you know, while he may not be doing it in the rest of the country, he was doing lots of local media, national media. He's trying to shape and change the image that people already have in their mind, as Emily was talking about. It's interesting to note that he's meeting with that he met with roundtables of women, women who suffered from domestic violence. Pierre Poilievre has a women problem. This is one way to approach it. I thought it was really interesting in his conversation with Patrice Roy, the clip that you just aired, where he talked about, you know, respecting Quebec's autonomy, because the one thing that is going to cause him a bit of a pickle, frankly, and I'm sure the Bloc Québécois is going to be reminding Quebecers of this, is Mr. Poilievre has changed his tune on Bill 21, which is not Mr. Scheer's position. It wasn't Mr. O'Toole's position. He supports, or has said that he's not going to change the federal government's course if it decides to appeal the law now to the Supreme Court. He seems to be walking that back a little, but on that question, on abortion, on climate change, these are all things where he and the people who support him, and that is key. The caucus that dumped O'Toole and decided to back Pierre Poilievre very much do not have values and policies that align with the majority of Quebecers. So that will cause him a problem.
Andrew?
I agree that Mr. Poilievre has very much an uphill climb in Quebec, partly for his own personal reasons, partly because of the stances his party has taken on things like guns or climate change. But let's get real. There's only been 2 conservative leaders since the 1890s that have carried Quebec. You know, so basically, if you're a conservative leader, you have 2 options. You can lose in Quebec, but preserve your dignity and your self-respect and some kind of coherent message for the country as a whole. Or you can pander shamelessly to every Quebec nationalist wish list, sell your soul, and still lose your deposit. The past couple of conservative leaders took option B. It may be that Pierre Poilievre will take option A. I think he'd be better advised to do so. I think Stephen Harper showed you can win the country without winning a whole lot of seats in Quebec. The numbers didn't used to be there, but if you put together a majority in Ontario and the rest of the west of Canada, you can. And secondly, you don't need to win a lot of seats in Quebec. You just need to be respectable there to get Ontario to win seats, win seats in Ontario. And if you win enough seats in Ontario, Quebec will start to give you a look.
Very quickly, Chantal.
Except that, as opposed to Stephen Harper, Pierre Poilievre has an Ontario problem, and it's called Doug Ford. By the time the next election comes around, chances are the Conservatives are not going to be very popular provincially. And ask Paul Martin how much it cost him when Dalton McGuinty was imposing a health levy and there was a federal campaign on. So yes, Andrew is totally right. But I'm not so sure that the prospects of a big win in Ontario are as great under a Conservative government in Ontario as they were for Harper when the Liberals were in power at Queen's Park.
20 seconds to you, Emily, and I got to go.
There's a lot of Ontarians who know Pierre Poilievre already, and a lot of them have decided to dislike them, so changing that opinion is harder. There's a lot of Quebecers, if you ask them if they know about Pierre Poilievre, they don't like him, but there's also a lot of people who just haven't made up their mind yet. It doesn't mean that it would be hard, that would be easy for him to change their mind. It's just that he's starting from more of a negative perception in Ontario than in Quebec, where there's often no perception at all.
Okay, I got to leave it there. Good conversation, everybody. Appreciate it.